Welcome everyone to the maternal and child health video. So, what needs to be done to take care of the child during the childbirth process and definitely post childbirth? What needs to be done around here? So, agenda is to appreciate the maternal health and the child health simultaneously. Appreciate between the link about the issues of mothers and children. Understand the consequences of ill health to be able to enlist the global strategies in place for MCH, as in maternal and child health care, to appreciate the strategies of maternal and child health care uh, in our world, in everywhere. So, specific objectives of MCH or maternal and child health is reduction of maternal, perinatal, infant and childhood mortality, in fact, morbidity also, promotions of reproductive health, promotions of physical, psychological development of child and adolescent within the family thereby. Let us talk about the component of maternal and child health. Maternal health is all we are talking around here, the pregnant lady that we are talking around, family planning, number of children perhaps per mother, per family, child health, as in the health, nature of the child, school health, the education of the child, the handicapped child, in case somebody is physically challenged, and care of the children in special setting as a daycare facility. So let us start with the maternal health. Fast facts about maternal health. Each and every day, approximately 1,600 women die needlessly during childbirth, during pregnancy. Many are undernourished, and during their pregnancy, these women often lack information and appropriate voluntary services for family planning and post abortion care. Many women lack information and services during their pregnancy and receive inadequate health care before, during, and after delivery. Women continue to die at the rate of one per minute on everyday basis, which are probably caused by preventable causes, preventable disease related to pregnancy and childbirth across the world. A woman's death during childbirth often means the death of a newborn too, and that is the reason why we should be emphasizing upon the maternal health. Remember, a healthy daughter is equal to healthy mother, and they are interrelated. Provide adequate educations and correct information regarding what in early adolescence, nutritional requirements, proper eating, pubertal changes. In later adolescence is all about contraceptions, birth spacing, small family, child rearing, and breastfeeding. Infancy, adolescence, and pregnancy all are interrelated to women and women centric only. Remember, infancy, adolescence, and pregnancy with lactations. So we are looking, our focus is on a healthy mother and a healthy children thereby. So what are the causes? Basically, what we are looking into it. Let us talk about the infancy, adolescence, pregnancy about a woman. Causes of malnutrition. Now, this is what you need to go around it. Stunting or small pelvis. Nutritional deficiencies, iodine, iron, large family, closely spaced birth, as the case might be. Why this malnutrition? Or let us look into this, which has been aggravated by early marriage at a lower age of the girl and lower pregnancy age, also teenage pregnancy. Now, why does this happen in the first stage? Because there's a poor nutrition in the environment altogether, inadequate breastfeeding, delayed weaning, misconceptions about food. People might have allergies. People might have a distaste for a for a food which is nutritionally very rich. Poor status of the woman, lack of education. Then we call about the psychosocial, improper education, child rearing, breastfeeding. No education is all about contraceptions, birth spacing, and small families as on when on basis. Now these are things that needs to be taken into care. Why are we looking into it? At birth is the nutritional deficiency, prematurity, low birth rate, and delivery problems as on when on basis. So this is what happens and at birth. But what about at rearing during the growth years, after pregnancy, post pregnancies, after delivery? Probably you've not been able to feed properly. There's a large family to look after it. and cannot educate the child adequately or responsibly. And that is what is basically crumbling the society altogether. So, yes, the malnutrition of the woman will lead to sick mothers. That means at birth there would be a low weight of a child that would be born, who will be an unfit children. Should I say, even if they are unfit or even if they are delivered, their life during rearing the process or upbringing of the child, it takes a lot of an effort, and there might be certain constraints that might not lead to a healthy childhood altogether. Phases of maternal health. We're talking about the nutrition, the fetal growth, the growth of the baby in the womb, the fetal growth, the birth weight, the nutrition during infancy is very important. Then comes the infections. Maternal apps, as in passive immunity. Maternal immunizations protects against adverse outcome before pregnancy as on well-known basis. Talk about phases of maternal health during pregnancy: nutrition, weight, anemia, care of breast, infections, rubella, syphilis, malaria, UTI, urinary tract infections, tetanus immunizations, smoking, heavy work, heavy stress, psychological stress thereby. What are we looking into it? The labor and postpartum. We are talking about infection, ophthalmia, neonatal, tetanus neonatal, as the case might be, bleeding, trauma, asphyxia, lactation, birth spacing, family planning, as we talk around it. Now, global causes of maternal mortality. Hemorrhage is 34%, hypertension is 18%, indirect causes approximately 18%. There are other indirect causes, other diet causes, embolism, abortion, and sepsis that goes around. Global causes for the death of pregnant lady, perhaps. And this is what I'm giving you a data from 2010, and it's a WHO World Health Organization data. So why do these women die? There are three delay models what we can do around: delay in decision to take care or seek care, lack of understanding of the complication, acceptance of maternal health or maternal death in certain societies that this is bound to happen, low status of the woman, socio-cultural barriers to seeking care. Next is delay in reaching care, mountain, island, river, and poor organization. Third is delay in receiving care, as in supplies, personnel, poorly trained personnel with punitive attitude and finances thereby. Let us look at the global target, the six MDGs. What are we looking into? Maternal development goals to reduce maternal mortality ratio by three quarters, by 75% between 1990 and 2015. Defining maternal death. Let me define it out for your convenience. Maternal death is a death of a woman while pregnant or within 42 days of the termination of pregnancy, irrespective of the duration and the site of pregnancy, from any causes related to or aggravated by the pregnancy or its management, but not from accidental causes. WHO, which stated in 1993. Pregnancy related death is the time of the death. Definitions, irrespective of the causes. Late maternal death, the death of a woman from direct, indirect, obstetric causes for more than 42 days, but less than 1 year after the termination of pregnancy. The indicators of maternal mortality ratio, maternal mortality rate, lifetime risk of maternal mortality, proportional maternal. Now we're talking about the maternal mortality ratio, number of maternal death in a specific period, to be divided by the number of live birth in the same period times 100,000. Remember, number of death divided by total number of birth times 100,000. Interpretation: MMR or maternal mortality ratio is 50 to 250 per 100,000 live birth. Problem with the quality care. If this ratio comes around 50 to 250, there's something grossly wrong. If MMM ratio is above 250 and per thousand blood, problems with quality and care and access. In fact, the requisite healthcare is missing. The infrastructure is not there. So, number of maternal death in a specific period by the total number of women in the reproductive age times the thousand is maternal mortality rate. Relationship between maternal mortality rate and maternal mortality ratio. Remember, this is the number of women in productive age. So, maternity mortality rate is nothing but maternity mortality ratio times GFR. That is the general fertility rate, as the case might be. Similarly, maternity mortality ratio is maternity mortality rate divided by GFR, general fertility rate. Oh, years given out here. And what is general fertility rate? Is number of live births in a period by number of women in a reproductive ages in a period times 1,000. Other maternity mortality indicators is lifetime risk of a maternal mortality, number of maternal deaths over the reproductive lifespan, divided by women entering the reproductive period. Proportion of all female death due to maternal causes is equal to number of maternal death in a period divided by number of all female death in the same period into 100. Now that is proportional maternal death that we are talking about. Remember, number of maternal death but to be divided by all female death in that period. In fact, reproductive ages of that period into hundreds or times 100. So where do maternal mortality data come from? Vital registration. It's everything that has been registered in the PHC or the primary healthcare center. Uh, Maternity mortality rate and maternity mortality ratios. Health service data will show you the special studies in terms of hospital study, research, longitudinal studies, verbal studies, surveys and census, direct and estimation rate and ratios, sisterhood, motherhood, anything that you want to look into it. The indirect method of rate and ratio, perhaps, the intervention that we all ascribe for a wonderful mother and a beautiful child is all about safe murder. What are we looking out here? We are talking about equity for women. Absolutely, health wise, we are talking about the primary healthcare center, the basic maternity center. What is FP standing for? FP is your family planning. ANC is antenatal care that needs to be taken care of. This SD is all about safe delivery of child, remember, and EOC is emergency obstetric care, as the case might be. This all will lead to a safe motherhood, and that is what we all would love to strive to go for. Interventions for maternal care. Antenatal care is nutritional support, as in the lack of iron, anemia. Personal hygiene, dental care, rest and sleep. Immunization is mother and the newborn, the child. Education in delivery and care of the newborn, identifying the high risk pregnancy, emphasizing the ANC antenatal care visits and maintenance of the ANC card, importance and management of lactation, milk, breastfeeding, advice on birth spacing. We now let us address the child health issues. Remember, the health of a child is the power of the nation. Some facts about the newborns of survival. Approximately 11,000 newborns under the age of 4 weeks die, and there are approximately 11,000 stillbirths. Sibling bonds to those closely spaced together places mother and infant at an increased risk of complication. More than half of the babies who die have a low birth weight, and many babies are born to be undernourished, unhealthy mothers. Many newborns are not breastfeeded immediately after birth, nor exclusively, or are fed inappropriate food, leading to malnutrition and illness. Many mother and the newborn receive adequate health care to address complications arise from delivery part of it. Most causes of newborn death due to birth, asphyxia and injuries, infections, complication and prematurity and congenital abnormality which is preventable altogether. Childhood health problem, infectious disease, congenital infections. We are talking about abortion, stillbirth, congenital diseases and malformations. Talking about neonatal infections are what? We are talking about ophthalmia, neonatorium, tetanus, and vaccine related diseases thereby. Malnutrition is all about protein, energy malnutrition, iron deficiency, anemia, rickets, and vitamin deficiency. Talking about injuries of several categories, including bones, fractures, chemical poisoning, swallowing of an object, road traffic accident, burns, and drowning. Child survival strategies during 70s, 1970 PHC primary health care movement with its commitment to tackle underlying social, economical, political cause of poor health and emerged largely focused health child health. During the early 1980s, focus was shifted from PHC to the vertical single issue program to achieve cheaper and faster result, leading to child survival reproductions of 1980s, spearheaded by UNICEF, built around packages of interventions grouped under the acronym GOBI, GOBI, growth, ORS, breastfeeding, and immunizations. The inherent limitations of these vertical approaches soon become as apparent as possible, as workers have to deal with a large range of health problems, and single issue programs were not designed to provide such guidance. A more comprehensive view of the child is required, dealing with the children, not just with the disease. An indicator thereby is the mortality in infancy and childhood, prenatal mortality, neonatal mortality, infant mortality under the 5 age group mortality rate. This is what we need to go around it. Between 28 weeks of gestation, it's all about stillbirth. You require approximately 36 months, 37 weeks, sorry, 36 weeks, 37 weeks of a duration for a live birth to happen. Then we have something called prenatal birth, at birth. What is looking during birth, after birth, immediately during the birth. So early neonatal death that needs to be taken into consideration. Late neonatal after taking birth of 7 days to 28 days within a month's time. So these are my neonatal days that comes around here. Then is the postnatal days, which is from 28 days to approximately 1 to 5 years if there are any issues to be taken care of. Remember, Nelson Mandela way back in 1988 stated there can be no keener revelation of a society's soul than the way it treats its children. So please love them, respect them, and probably take good care of them because ultimately they are the future of our species, humanity. They are the future of our nations too. With these words, I will wind up this today's video. Thank you.